Hi everyone, Dr. Rich Castellano, the Smile Doctor from ImageLift, here today with Dr. Rich DiCicco. Thank you so much for doing our interview today. I'm really excited to learn more about weight loss surgery. Weight loss is, a big issue going in the United States, so thank you so much for doing the interview today.
My pleasure, two Dr. Riches.
That's right, we got the Rich and Rich. So which Rich are we talking about here? So now you're with Florida Surgical Weight Loss Specialists.
Yes.
Right? And people can find you on, tell me that site where they can find you.
So the website is tampagastricsurgery.com. And then I'm pretty easily findable just by Google.
Yeah,
So
you need to find this guy, he's amazing. So weight loss surgery, tell us about weight loss, like who needs weight loss surgery? It's a big thing. What do we need to know about weight loss surgery?
So what do we need to know? The important things of weight loss surgery is it's minimally invasive surgery nowadays. So it's much different than what people still think about from years and years ago. The advent of modern bariatric surgery is probably 25 years ago when we started doing this via laparoscopic or small cuts, minimally invasive surgery. So that kind of kicked off with gastric bypass surgery, and then we had lap band surgery, then gastric sleeve surgery. We also do duodenal switch surgery. So there's a lot of big names, but basically these are the major surgeries that we do.
So now, a lot of options, and they're minimally invasive, and so about a third of the American population is obese.
Correct.
1/3, so that's about 110 million people. That's a lot. And when at that
But not
level,
all of those patients are candidates.
Got it.
We don't necessarily start becoming a candidate until we get class 3 obesity, let's say. So, in reality, we do this based off BMI. Now, what's BMI? It's body mass index, and it's a ratio. It's a ratio of your height and your weight. This has been classified a long time ago, but with some recent updates to it. So basically, what we're talking about is somebody in the United States with a BMI of 35 or more.
Right.
And it used to say a BMI with 35 and major health comorbidities. Now, health comorbidities
hypertension,
are
diabetes,
sleep apnea. These are the big ones.
Okay. And so if you're about 5'8", to get a BMI of 35, you got to be in 250, 270,
Yeah,
roughly?
well, if you're 5'8", yeah, probably a little bit more than that. But
Almost
our
300
average
pounds,
patient is going to be a female, because most of our patients are females, but we do lots of, males as well.
Yeah.
Like let's say 5'4", 250 plus.
Yeah. And then when you have the diabetes, high blood pressure, sleep apnea, that shortens your life, right? That's serious stuff. So the weight loss surgery gets them to, once you get the weight off, those comorbidities get better, and it helps to prolong people's lives.
Right. So that's an interesting point that you bring up here, because a lot of people, when they find out I do weight loss surgery, they think it's liposuction or something to that thing. And actually it's not. When you have surgery and you come out of surgery, you probably weigh roughly the same, maybe even a little bit more because of the IV fluids we give you.
Right.
And it's what happens over the next several months, year or two, that really determines what happens. And that's your body is shrinking. Basically, you're burning the visceral fat, and you're going to go from the morbidly severely obese BMI down to roughly normal, or at least below 30 is our typical goal. BMI of 30.
But it's clearly been shown that once you get to that point, you're 300 pounds, BMI 35, in those ranges, and you have these comorbidities, when you have the weight loss surgery, you get better. You're making a significant impact on these patients' lives. I see them in my office. They come once they lose 100 pounds or more, and then they have extra here. They come, and of course sometimes they want nips and tucks and so forth. I just focus on the neck. So from my patients' experience, I've just had a lot of patients who have had a good journey and a great experience. So it's not something that's for everyone, but if you're in that category of 300 pounds plus, diabetes, hypertension, and just not able to lose the weight, that's where you're able to help these people.
That's true. So, I leave the cosmetic work, and sometimes it's actually medically necessary for people to have plastic surgery after they've lost significant weight. And that's due to rashes or infections and things like that. But
Interesting.
mostly, I'm not doing cosmetic work.
Sure.
My goal is to do, major surgery on your stomach or intestines as needed, and basically allow that metabolic change to happen, to lose the weight, and then allow the secondary, physical changes to happen through, plastic surgeons such as yourself.
Now, do patients, by the time they find you, have they been through dietary, or do you say, you know what, you need to go through the dietary regimen, and if they fail, how do you guide someone who's thinking about it? You give them the option to say, you know what, based on your comorbidities, you need to go, you're a candidate to do a procedure now, or you say, let's try and get you through a program, and if that doesn't work, then this is an option. How do you guide patients?
So, that's a great question. Most of the time when people have found me, it's not the first thing that they're trying to do to lose weight. By the time you're 250 plus pounds, you've been on some form of diet. And nowadays there's other treatments out there in the world too, such as medications, diet pills, diet shots. All of these things are, part of the process. But, what we know from the medical literature is that surgery still is the best thing to not only help you lose the significant weight you're looking to lose, but also keep it off in the long run. And that's ultimately the goal, is to get you healthier and also keep you healthier.
Got it.
So we have a whole program here in place. So, I've got a great team. It's not just me doing surgery that makes someone successful. You've got to be a motivated person who wants to take on this surgical tool to help you. So when that happens, we bring you in, we do a consultation, we talk about your health issues, we talk about the types of surgeries, because like I mentioned earlier, there are different types of surgeries, and it's not one procedure is best for everybody.
Sure.
Now, some bariatric surgeons just focus on one type of surgery. They only do gastric sleeves, or years ago they only used to do lap bands. In my practice, I'm a comprehensive bariatric surgeon, so I offer, the gamut of what's available out there in the world, and I try to tailor it to what your needs are as a patient based off, your age, your BMI, your health comorbidities, and then, we try to do the best thing. And I also do a lot of revisional surgery.
Right.
Meaning, that sometimes people have had bariatric surgery in the past, and for whatever reason, they've had some sort of issue and it needs correction or a conversion.
Got it.
So we do those as well.
And you're not the typical weight loss surgeon, because you've been doing this almost 20 years.
I guess I'm getting older, thanks for calling me old.
We call it mature and wise. You still have many active years ahead of you yet. But that being said, the average surgeon is doing 150 cases a year or something like that. And
I think,
how many are you doing?
So we've been, blessed to have a very good and robust program here, and I average in the range of about 300 procedures a year.
That's amazing. That's amazing, right? You're doing like double what a lot of people do. And the fact that you're using the robot, because not all weight loss surgeons are using the robot, is that correct?
Sure. So, we use a surgical robot, Da Vinci Robotics, and our hospital system has a lot.
You have 5.
We have 5 at our hospital.
5? That's a lot that's amazing.
It is very amazing when you factor in how much they actually cost. But the technology is worth it. The patients do well. It allows me to not only control my own 2 arms, but 2 additional arms and a camera. So I get a lot more freedom to do, this minimally invasive work that we talked about, with much better precision, but more importantly to the patient, faster healing, with less pain. So most patients only spend, on average, 1 night in the hospital with us after surgery like this.
For something like this, right, it's less invasive, less recovery, and you have more control and precision.
Right.
It really is remarkable what this technology can do, and you are really leveraging it. So that's
right.
That's amazing.
And I know some surgeons have even talked about letting their patients go home the same day after the surgery, but this is still real big major surgery, so we like to watch everybody overnight. Even if I could get away with sending you home, as a surgeon, I want to make sure we're doing the best quality work for you to minimize the complications. And that's another thing that I guess sets us apart from other practices, is we've been recognized by Health Grades and several other organizations as being within the top 5% of lowest complications in the country.
Yeah, no, that's amazing. There's no substitute for experience. Now, I'm curious, what is your favorite part of the patient's journey, right? They come to see you, they do the procedure, then there's the aftercare and follow-up, but what do you like most about this whole process?
That's a great question. There's so many different parts of the journey that I find fascinating. It's nice to see somebody kind of nervous in the beginning and they come in and they want to make this change. And then you kind of tell them some of the benefits to it, and then they get a little bit more excited. So it's just kind of that energy of activation that the patients have. But I'll tell you, my favorite part is once they've had the surgery and, they tell you, oh, that wasn't anywhere near as bad as I thought. And then month after month, you're watching them lose, 12, 15, 20 pounds or more until they get down to a lower weight, and then they're telling you, you know what, I was able to go to the theme park with my kids or my grandkids, and I was able to ride the rides, or I got on an airplane and I didn't need a seatbelt extender. It's just kind of like the little quality of life changes that happen, and then and then you find out, my doctor said I don't need diabetic medication anymore. I don't need my blood pressure medication anymore. I got rid of my sleep apnea machine. So all of these things are great, and it's really nice to watch the transformations. Patients, they'll post their little videos where they show a before and after. And I mean, I've been doing this for 20 years, so I've got thousands of patients out there, and it's just nice to see the amount of lives that we've changed. And at some point we need to calculate how many total thousands and thousands of pounds patients have really lost over the years.
Yeah, there's the physical and health impact for this weight gain and the weight loss, and a mental impact, but there's a social impact as well. I mean, socially, once you get to that weight, there's a lot of difficulty there.
Yeah, difficulties, and it's also interesting that people will tell me they had to have their IDs changed because they went to the store and they couldn't believe that that was the same person, and they wouldn't, they didn't want to accept that ID.
Yeah.
So, but I guess that's the least of your problems at this stage of the game if you've actually gotten yourself that healthy.
Sure, but it is an enormous transformation. In life, everybody wants to advance their life. We all want to grow. We all want to do our best every day. And when you find yourself, you're in that situation where you've got that weight and they need the expert, you're the person that they need to see to say, what do I need to do? Where do I need to go? And if you're not a candidate for weight loss, what percentage of patients would you say come to you? I guess they self-select, but what percentage would you say, you know what, you're not really a candidate versus you are? How does that break down? What would you say?
All right, so there's a lot of screening that actually happens before they make it to my consultation room. So I will say it's pretty rare that if you've made it in front of me that you're not technically a candidate for surgery. But every now and then, due to either health problems that you have, certain surgical procedures you've had in the past, or certain medical conditions, you're not necessarily a candidate for surgery. But I would say, if you meet the general guidelines, BMI 35 or more, with health comorbidities, with or without, generally you're going to be a candidate for surgery in some capacity. And at that point, we'll guide you. Is surgery the best option, or should you try medical weight loss options first?
Right. Got it.
And we're in the process. Obviously, as a surgeon, I spend most of my time doing surgical weight loss options, but we're adding a medical weight loss component to the program. Somebody who does what I do, but only on the diet pill shot side.
Right. And once they do a weight loss procedure, they can also do the weight loss drugs as well.
Correct. No, that's correct. The two. That's important. There's no perfect treatment for obesity that we have right now. Surgery is not the be all end all. Diet pills and shots, clearly aren't either. But sometimes you need a combination of both. Let's say you had gastric sleeve surgery and you've lost significant weight, but you still need to lose a little bit more, and the metabolic changes of surgery are starting to decrease. Well, then, we could add one of the new medications. You might have heard the word semaglutide or Ozempic, which is, technically for diabetes, but it's actually one of these new GLP-1 medications. Now, those can also kind of kickstart the process. Now, let's say we've tried, some medications and that's still not working. If you're a candidate for revisional surgery, we can also do that. In my practice, patients have sought me out from all over the country, for revisional surgical needs.
Yeah. So, this has been great. I really love this. So now, if a patient has, we talk about the different options for patients. I found in my patients, the answer is always inside of that patient, because you got to do something that they feel good about, that works with them. So it's always about customizing. So if somebody is doing their research and they're thinking about weight loss, if they're thinking about weight loss surgery, obviously their BMI is high, they want to lose some weight. What would you guide someone? How would you guide someone and say, okay, do this, this, and this? What are the basic things people need to do as they're on this weight loss journey?
Okay, so if you've come to our practice, and this is pretty standard through, most criteria for bariatric surgery, everybody needs to participate, in some sort of monitoring for a short time while we work to complete bariatric specific psychological evaluation and clearance. So everybody needs psychology clearance. Everybody needs nutritional guidance and counseling. We have 2 great dietitians in our office, so they'll meet with them, discuss, the implications, because not only choosing the right types of food, I think people know what's generally healthy, but they need a little bit more hand-holding or more guidance, let's say, in terms of kind of meal planning, portion planning, but also because you're going to be eating reduced calories, you need other nutritional supplementation. Let's call it vitamins and minerals, nutrients. So the dietitian kind of helps with that part of the process. In my practice, I also like to have endoscopies performed, and that's a minimally invasive procedure, usually done by gastroenterologists, where they put the camera inside your stomach to make sure everything looks good on the inside of the stomach to further help us plan which type of surgery you should get. I do all of the surgeries, but probably gastric bypass, gastric sleeve are the mainstay operations that are offered.
All right. And then tell us about your team. Who do you have on your team that helps you to do what you do?
This is a great point, because by myself, I can only do so much. So without my team, I'm pretty helpless. My team consists of my office staff and my hospital staff. So, I'll talk about kind of each team individually. Now, the ladies here in the office, our office staff, helps coordinate all the patient care, the patients that come in, coordinating the appointments, but also making sure people stay on track with the checklist items that we've set out. Because again, bariatric surgery isn't, you come in, you see me, we say, yes, you need a gastric sleeve, and then, next week you have surgery. It's a whole process when you're getting the psych evals, the dietary evals, and all these other medical and cardiac clearances sometimes as well. So my office staff helps with that. I also have surgical schedulers, because we have a large volume of patients. We've got to keep things on track for the hospital, but also dietitians. So the dietitians provide a lot of the nutritional counseling and support. As a surgeon, I know a little bit about the dietary aspects of this, but I do some leaning on my dietitians because I think they're great.
Sure.
So that's kind of the team that I have in place here on the office side. Now, on the hospital side, there's a lot of people to meet. We've got a dedicated surgical floor. So they're all private rooms, which is nice. They're all newly remodeled. So the patient experience in the hospital is phenomenal. People rave about it all the time. So from the time patients come in the morning to the pre-op area, they meet people that are very familiar with dealing with, our patient population. So they're great at putting IVs in, getting patients comfortable. And, this is a team I work with week in and week out. So, we're definitely familiar with the needs of the type of patients that I treat.
That's really important, because it's one thing to take care of patients and do the right thing medically and get patients what they need. But patients need to have a good experience, because even if I have to go to the doctor, like, everybody's heart starts racing a little bit when we have to go to the doctor. So I love your nature. I feel very calmed down just talking to you, right? And that's so important, because, when you can calm the nerves and everybody sees that they're going to be treated by good people and taken good care of, then we know everything's going to come together.
Yeah. So no, I love surrounding myself with great people. My team gets a lot more praise than I do, and I'm totally fine with that.
Well, it's good to have a great team and
Yeah.
need our great teams. So this has really been wonderful. I've learned a lot, and this is going to be our patients always asking me questions. So I'm glad we can share this with them so they can hear it straight from the source. Anything else that we need to talk about for people who are on their weight loss journey, maybe considering gastric bypass, weight loss surgery? Anything else that we need to talk about?
So, some people will ask me certain questions and then they'll talk about, risks and regrets and things like that. One of the biggest things that I hear from the patients are their biggest regret is that they didn't do this sooner. They waited too long. They waited till these health comorbidities got out of control.
You can kill your knees and your
Right.
joints with carrying all that extra weight, and if you do this sooner, you can protect some of your, body's reserve.
And if you have, if you're in the category where weight's this kind of an issue and you don't have diabetes yet, you're kind of a ticking time bomb. It's possibly going to happen soon. High blood pressure is going to creep on. Sleep apnea is going to come. So, the moral of the story is do surgery earlier. You'll get a better quality of life in the long run. You'll feel better. You'll be around to take care of kids, grandkids, all of these sorts of things. And the most common reaction immediately after surgery was, oh, that's nowhere near as bad as I thought it was going to be. So, in reality, the risk of doing these type of surgeries nowadays in our modern medicine era, it's actually a lot safer to do surgery than to remain morbidly obese.
Right, yeah. Well, on that note, I thank you so much for your time. This has really been wonderful. Dr. Rich DiCicco, and thank you so much. What's that website where they can find you again? What's the best way people can look you up?
So look us up on tampagastricsurgery.com, and and I'll give you information to contact the office.
Yeah, we'll put that in the notes, and really appreciate your time, and thank you. You are really a weight loss center of excellence, right? Because this is all you do. That's the one thing you do. You do it very well. You do more than most other doctors out there. So
yeah, and we are accredited by all the the American Society for Metabolic and Bariatric Surgery, the American College of Surgeons, and we also have a lot of insurance-specific centers of excellence, which a lot of other programs don't have. So it generally allows us to do kind of the widest variety of patients out there with different insurances. But in case your insurance didn't cover, there are affordable cash options as well.
yeah, very good. All right, very good. Dr. Rich DiCicco here. So proud to know him. We'll have more videos coming soon. Thank you all for watching. We'll see you later.